doing today?
Not so good.
Yeah, I was reading and it said you're having some pain today.
Yeah,
What's going on?
it's my back.
Okay, what's going on with your back?
I got a herniated disc, and when I went to get out of bed today, I couldn't even get up.
How long have you had herniated disc?
I did it last year, but it comes and goes.
Okay. And you said you couldn't get up?
Oh. Sometimes I could wait it out, but the pain is so bad.
Okay, what were you looking for from us today?
I need to. I'm seeing spots. I've never felt nothing. I need something. Can you put me to sleep or something?
Unfortunately, we don't have anything in the office that strong. We don't keep those kind of meds on hand.
I might throw up.
Okay. There you go.
Can you give me something for pain? Please, I'm begging you.
What has worked for you in the past?
They gave me some. I can't remember what it was called.
Okay.
Hydro something or other. It ain't happened for like 6 months. I don't care what, just anything for pain.
Okay. Unfortunately, we don't keep strong pain meds in the office.
You can't give me nothing. There's nothing you.
We do not keep those kind of medications here.
It's been like this since this morning. I need something to ease the pain, please.
And you said it's been 6 months since you've had any of these symptoms?
Yeah, it came on last time all of a sudden, and I think it was like a week.
Well, because we have here that you were in the ER 2 weeks ago for back pain sore, actually. And that you got a script of 30.
It hurts so bad. I don't even remember the last time I was in. I need something for the pain, please. I'm begging you.
Well, you should still have the medication from the last time you were in.
It was stolen. Listen, I need something for pain, please.
Okay. Do you have a police report to show that it was stolen?
No, I don't.
And then without a police report to show that you have anything.
I need to see your supervisor. I need something for pain.
Okay, well, I am the supervisor.
This is bullshit. I need something, anything. You gonna tell me you're not gonna help me?
I am doing everything I can to help.
I need something for pain. I'm begging you, please.
So, what can we do? If we can't give you any medicine, what can we do?
What can we do? Put me to sleep. Anything.
We don't have anything that strong.
There's nobody else I can talk to but you?
I'm it.
Psychologist, and currently the acting chief of addiction services at Hamilton Center in Terre Haute. Part of my job today is to help you understand what it's like dealing with an individual who presents in your clinic or your emergency department who is drug seeking. Pain is often the most common patient complaint when individuals come in drug seeking. And pain, as you know, has to be dealt with in every single visit. It's one of the vital signs. It's important to remember that not everybody who is seeking medication is automatically somebody who is doing it to get high. There are individuals who are dealing with chronic pain who also abuse prescriptions because they just don't know how to deal with their pain. Not all drug seekers are faking their symptoms. They may have a legitimate complaint, low back pain from a lifting accident, and over time they've become physically dependent upon the pain medication to function. When we talk about addiction, we talk about different signs of addiction and abuse. Common behaviors of individuals that use and abuse prescription drugs include escalating the use by increasing their dosage and frequency because the prescribed amount is not enough and it's not reducing their symptoms. Seeing multiple physicians for treatment of the same problem and over a shorter period of time. We might call this doctor hopping. And you might see scams orchestrated to obtain large amounts of high street value brand name medications. Individuals who abuse drugs usually have manipulative personality traits. Some of these personality traits include having an assertive personality, often demanding immediate action. Their dress might be a little different. They might be underdressed, severely underdressed, or very overdressed. They will have knowledge of the medications that they are wanting, and that you may want to give them, as well as knowledge of symptoms that these medications treat. They will often give evasive or vague answers to history questions that you ask. They'll be reluctant to provide references or provide records, like information like address or insurance information, the name of their regular doctor. They will request, or may request, but often will request, a specific drug. If you offer an alternative, a lot of times they'll come back and offer that ask for that very specific controlled drug. They may exhibit mood disturbances and suicidal thoughts. And in the hospital, a lot of common methods used by drug-seeking patients include this: they must be seen right away. There is no waiting. They wait until the evening or night or even on the weekend to call with a problem that they've had all day long. They'll state that they're from out of town and they're just traveling through, and that they need this medication right away. They'll feign physical problems, herniated disc, migraine, a lot of times something that cannot be examined through a regular test in the ER. They'll feign psychological problems such as anxiety, insomnia, fatigue, depression, in an effort to obtain stimulants or even depressants or anti-anxiety medications. They'll say that specific non-narcotic medications will not work, and that they're allergic to them. They will have reasons why nothing but the medication that they're wanting will work. They'll often say, and we hear this a lot, the prescription was lost or stolen, and that they need a refill right away. They will often pressure the nurse, the provider, the practitioner to give them what they want by eliciting sympathy or guilt, or even by directing threats. So a lot of verbal and physical intimidations to heartbreaking pleas for understanding. A lot of compassion are common. Some examples of scams include, I have a tooth pain and I can't get in to see my dentist. Can you please prescribe me something until that time? I'm new to the area, can't get in to see my primary care physician. I just need this to hold me over. I have an appointment next week, but I need something to get me through the weekend. I was beaten up and they took my Vicodin prescription that I just got yesterday. A lot of other ones we've heard is my family members had some friends over and they stole my prescription right out of my bathroom or right out of my bag. My insurance only pays for prescription if it's multiple refills or if there's 50 in it. And if they're doing that, then they're really not up on the new laws, because we all know that we get 7 days initially. So you'll know immediately that that's a scam. It's important to follow your department specific policies when you see something like this. Your department, whether it's an outpatient clinic or an emergency room, should have department-specific policies and protocols on how to deal with drug-seeking behavior. Actions could include calling law enforcement, refusing to meet the patient's demand for prescription medications, communication to other healthcare providers, checking the inspect report, and that's going to be a requirement. The governor just signed that into law. If you believe a controlled prescription medication isn't clinically indicated, don't prescribe it. It's simply that simple. Don't administer it. If the confrontation is escalating, stay out of arm's reach. Call for law enforcement if needed. We talk about LEAPS, L-E-A-P-S. Listen, empathize, ask, paraphrase, and summarize. These are the 5 basic tools to generate voluntary compliance. When we listen, you've got to look and act like you're listening. This is not listening. My husband tells me this all the time. This is not listening. Being at the computer and typing things in is not necessarily listening. When you're listening, you've got to act like you're listening. They may not be making sense, but they're going to know if you're listening to them. The moment your eyes glaze over, the moment you get lost, the moment you turn to the computer or get distracted, it appears that you're not interested and conflict can occur. It's important that they see you in the act of listening. The second point of LEAPS, empathize. It doesn't suggest that you have to agree with the person, but it does tell everyone that you're dealing with that they're entitled to their own point of view. Don't agree. You don't have to agree. Just try to understand where they're coming from. You may not agree with it. You may not like it. Just try to understand where that person's coming from. If people believe in you, in your service, in your desire to help, often that itself is enough to generate voluntary compliance, believe it or not. They don't have to like what you're going to say, but if they believe that you're going to help them, that is enough to generate voluntary compliance. This is policy, this is procedure, these are the grounds I have to stand on. This alone is going to calm people down, as long as you try to understand where they're coming from. The A in LEAPS is ask. There's a process of asking questions that can make you more skillful. Fact-finding, who, what, when, where, how, when, why. Don't be too quick with an answer before you can define the question. That's an important one. Don't be too quick with the answer before you can define the question. That goes back to our listening and empathizing. And this is often one that we kind of overlook, where a lot of times people are listening to answer the question rather than listening to understand. They listen to respond rather than listening to understand. And so it's important when you're asking questions that you understand the question. Ask for specific data. Don't lead to your point of view. Be as general as you can. This makes you appear calm, open, and that you understand. Is there some way we can solve this problem? Is powerful. Everyone likes to voice their own opinion when it's trying to solve a problem. And so asking the client, other than, I understand we have this problem, please understand that I can't prescribe this medication. Is there another way that we can solve this problem, becomes very important. The P in LEAPS is paraphrase. When someone comes at you with verbal abuse, forget the tone and the emotion. We have to check emotion at the door. People are going to hurt our feelings on an everyday basis. And so it's important that we check emotion at the door. Remember, these individuals are sick. They may not have the pains that they're describing. They may not have the ailments that they're describing, but it doesn't mean that they're any less sick, because it is a disease. Put the complaint into your own words, play it back for them, without the emotion, without the tone. It's not an argument, it is a statement. Let's take tone and emotion out of it and just look at the words and paraphrase it back to them. Even if you've misunderstood, they're going to see that you're trying, and they will want to help you get it right, okay? Remember, through this, you gained control of the conversation. And finally, the S in LEAPS is summarize. By definition, this means condensing, taking all the information and putting it into a concise statement. You must have 3 things to summarize. It must be brief, it must be concise, and above all, it must be inarguable. If these techniques do not work and the client, the patient, continues to get verbally escalated and then eventually physically escalated, remember to fall back on those policies and procedures that you have. Remember to fall back and get others involved. And above all, remember safety. So you just learned about preventative measures for our physical environment. And now I would like to introduce you to our 2 actors, if you will, that were in our situation. Ms. Jessica Neville is currently a therapist as well as the clinical director for the opioid treatment program at Hamilton Center. Mr. Brian Kendrick is currently a peer recovery specialist at one of our transition living houses. So talk to me about how you incorporated, I've educated them a little bit on LEAPS. Talk to me about how you incorporated LEAPS into some of your interactions with Brian.
Sure. So as he was talking about his pain level, I was listening and I was trying to find things that were effective for him before he went back to medication each time, and was very specific on, I want an IV, I want something to knock me out now. And so I was very responding to those statements that he made. So I was listening to make sure that I was hearing him correctly. And then I reflected those things back to him and said, this is what you're saying has worked for you before. So using those paraphrases and those summaries of, these are the things that I can do at this point in time, these are the things that you're saying, and we were not able to come to an agreement on treatment.
Okay. So Brian, talk to me a little bit about how it felt as the client to hear some of those things that Jess was saying to you using the leaps.
It's frustrating. As a drug seeker, immediately when you hear a certain context, you know that you're not going to get what you're looking for. When they start deflecting and suggesting that you follow up with therapy and talking about next week, you pretty much know you're in trouble. I was specifically drug seeking for hydrocodone. In my case, I don't specifically throw the drug that I want out there, or I make out like they gave me hydro. You place ignorant to it. In my experience with drug seeking, once you figure out that you're not getting the drug that you're seeking, you're gonna push, and eventually you're gonna storm out.
So has there ever been a case in your personal experience where you saw someone getting irate, aggressive, upset, or you yourself got irate, aggressive, upset, or has it always been, I'm not going to get the drug, I'm out?
Yeah, pretty much. There might have been some negative words on your way out, but I was never one that was trying to go to jail, and I wasn't trying to make the physician or the nurses angry, because ultimately I'm wanting something from them. And I'm not saying that you won't run into people that are aggressive. That just wasn't my approach when I was drug seeking.
But usually when individuals employ the leaps, the listen, empathize, asks, paraphrase and summarize skills, right? When they employ that, then would you say that it works as far as de-escalation is concerned, or it works as far as getting them out of the office, or both? That individuals are kind of keen to those skills and know that that particular behavior is not going to work with this particular provider? And does it also work when somebody is trying to de-escalate someone? Does that make sense?
In my opinion, I'd say it worked in all three. There wasn't too many directions that I can go with it. She was reflecting back what I was saying and letting me know what policy was. There wasn't too much I can do. At that point in the video, it was either get physical with her or leave, but I knew I wasn't, I could throw a fit, but I wasn't going to get what I wanted.
Mm-hmm. Mm-hmm. And do you think that's the case in most cases?
Yeah.
Okay. All right. Well, I appreciate you both doing this for me and for them, and appreciate your time. So thank you very much.
My pleasure.